purpose of this was to update, staff about the common rule and to get your feedback on this and how it can impact some of the research portfolios that you manage. So I'm just simply going to provide an introduction of what it is, and then we will have two of your colleagues who will come and actually really direct the dialogue and discussion about how it impacts the research that's supported by NIMHD. Okay, so what is the common rule? Let me just first ask, is anyone familiar with the common rule? You've heard the name, the common rule. Well, some people actually, surprisingly, have not, or don't really know the details of what it is, so that's good. It's essentially a policy around ethics and with research involving human subjects. So it's essentially a rule of ethics, bottom line. That's what it is. It's a rule of ethics as it relates to research with human subjects. So it outlines the provisions for IRBs, informed consent, and assurance of compliance. Okay, so there are 15 federal agencies who have signed on to the common rule, including HHS. So everyone is familiar with the famous 45 Code Federal Regulations Part 46, or CFR 46 is what everybody tends to roll off their tongue. So it has 4 subparts, and actually before I actually ask the question, since many of you are very familiar with it, can anyone share with me what those 4 subparts are? Anyone? Okay. So here they are. There's subparts A, B, C, and D. So that kind of makes it simple, right? So subpart A is also known as the federal policy or the common rule. That's the common rule piece. Subpart B is actually additional protections for women, human fetuses, and neonates. Subpart B is additional protections for prisoners, and D is for additional protections for children. Okay, so the notice of proposed rulemaking. So essentially, as everything happens in the government, anytime there are changes that are going to be made, you have to put out an actual public notice. So the NPRM is essentially a notice that is issued when there is a change that needs to be made. So they actually have to let everyone know, and it's usually published as most of our notices are in the Federal Registry. So the notice for the common rule was actually published September 8th of this year. And the interesting piece is, and I think the dialogue is going to really revolve around this, you have until December 7th of this year, as not as federal employees, but as the general public, to really provide comments about the common rule. So it'll be open until December 7th of this year. And what I'm going to actually go over is just the most significant changes. And then once I kind of give an overview of what those 8 most significant changes are, then that's when you all will begin to kind of have a dialogue and discussion about how those changes might impact the research that you manage. So the first is to improve informed consent. Has anyone, before I don't want to spend too much time on something that may be redundant for you, have you had a chance to see these changes by chance? Any of these 8 changes? Okay, so we'll just kind of do them. So to improve informed consent. So what exactly would that entail? Improving informed consent by increasing transparency and by imposing stricter new requirements regarding the information that must be given to subjects and the manner in which it is given to them to better assure that they are appropriately informed before they decide to enroll. That obviously will be extremely important, particularly dealing with vulnerable populations. So number 2, this issue of broad consent. So consent will generally be obtained by means of broad consent. In other words, consent for the future, for unspecified research studies. So for example, if you were going to do some longitudinal study for 10 years, you kind of get a broad consent in the beginning so that you don't have to keep coming back. So that's essentially what the broad consent piece. For example, part of the blood sample that is left over after being drawn for clinical purposes, even if the investigator is not being given information that it would enable him or her to identify who the biospecimen is. So thinking of things that we're doing now, like the Precision Medicine Initiative, where we know they're actually going to be taking samples, this issue around broad consent would really be applicable to those types of research endeavors. Excluding certain categories of activities. Excluding from coverage under the common rule certain categories that should be deemed not to be researched or inherently low risk, or where protections similar to those usually provided by IRB are separately mandated. So I know that here at NIMHD we've actually had a conversation about low risk research when we were, I think, kind of pulled together a few of the staff to look at the clinical trials that are supported here at the Institute. And so this issue of low risk research studies or research clinical trials may fall under number 3. Number 4 are additional categories of exempt. And these will accommodate changes in scientific landscape. In other words, kind of the new and evolving changes that are occurring. A new process would allow studies to be determined to be exempt without requiring any administrative or IRB review. So that's just adding on to the other piece. There are certain pieces that are going to be exempt, and then what they're saying here is you will not necessarily need IRB re-review of those particular topics. And so here's some of the new categories. Research involving benign intervention with adult subjects. And so again, in looking at some of the studies supported here at the Institute, and maybe some of you can speak more to that as well, many of the, or some of the behavioral interventions were relatively benign and involved adult subjects. So that may in fact fall under this new category. Research involving educational tests, surveys, interviews, or observations will also fall under this category. Secondary research use of identifiable private information originally connected as part of the non-research activity where notice of such possible use was given. And finally, storing or maintaining biospecimens and identifiable private information for future unspecified secondary research studies. So again, some of these may actually be applicable to a certain percentage of research that is actually supported here at the Institute. Number 5 is waiver of consent for research involving biospecimens. And number 6 is this issue around a single IRB. So it's going to mandate that the United States institutions engaged in cooperative research rely on a single IRB for that portion of the research. And I know this topic is actually going on in terms of the discussion around having a single IRB now with current large-scale studies here at NIH. They're really wanting to have and strongly supporting this issue around a single IRB. And number 7 is to eliminate continuing review requirement for some studies. I think that's pretty much self-explanatory, particularly for those studies that are merely analyzing data or involving observational follow-up. And the last is extending policy to cover all clinical trials. So extending the scope of the policy to cover all clinical trials, regardless of funding source, conducted at a U.S. institution that receives federal funding. So even if it is, I guess, minimal risk, low risk, the policy would actually still cover those clinical trials, not clinical research. So any questions about those 8? Because that's pretty much what you all are going to be discussing in terms of how it impacts the research that you manage. Any questions about those 8? Yes?
So in the subsequent discussions, are we going to hear about how the changes,
The proposed changes
relate to what currently is done? Because to me that...
Yes, that's what we hope